Hi, everyone. Thank you for joining us today for this webinar. We will get started in about a minute to let everyone in. Hello, everyone. We're just waiting for everyone to come in. We'll get started here in a few seconds. All right. I think this is a good time to start. So thank you all again for joining us today for our webinar. It's great to see you all. The Housing Alliance of Pennsylvania is a statewide coalition working to increase access to safe, decent, and affordable homes for all Pennsylvanians. We work to fulfill our vision for a home within reach through state, federal policy advocacy, opportunities to connect, share, and learn from your peers, events, and our annual Homes Within Reach conference. So if you aren't a member, we ask that you consider joining. You can visit housingalliancepa.org/become a member to join as a member, or you can contact Steph at info@housingalliancepa.org for more information on membership. What's going on? There we go. Okay. Today's webinar will run approximately 60 minutes, including question and answers. If you want to ask the presenters a question, please use the Q&A function. The chat function is only to ask the Housing Alliance logistical questions about the webinar. So again, use the Q&A feature for questions to the presenters. We will email you a recording of this presentation and any associated materials in approximately a week's time. Upcoming events, we have next Tuesday, October 19th at 2:30. Please join us. We have a webinar on universal housing vouchers. The speakers for this webinar will be Vincent J. Rena and Claudia F. Aiken, both with the Housing Initiative at Penn. And the Housing Alliance's own Gail Schwartz will be moderating this great webinar. You can visit our events page to register for this webinar next Tuesday. We also have our Homes Within Reach conference coming up soon. As the Commonwealth comes back strong from 2020, the Housing Alliance will be holding its 17th annual Homes Within Reach conference in Hershey, PA. This will happen December 1st through the 3rd this year, and we will be working to ensure all Pennsylvanians are moving on the road from surviving to thriving. The conference has moved to the Hershey Lodge in Hershey, PA, for a more spacious setting. We, along with the Hershey Lodge, will adhere to all CDC and state guidelines in effect at the time of the conference. In case you missed it, we have some resources on our website for people in need of assistance. You can visit housingalliancepa.org/for people in need of assistance for more information. And to learn about our 2021 policy agenda, you can also visit our website. And I will now hand it over to Gail to introduce today's webinar. Gail?
Thank you, Kina. So hello, everyone. My name is Gail Schwartz. I'm with the Housing Alliance of Pennsylvania. I'm the Associate Director of Policy and Strategic Initiatives. And I just wanted to say a couple of words before we hand it over to our amazing panel. So I often come back to a particular quote from Matthew Desmond that he wrote in his book Evicted, and that is the rent eats first. Research is showing that food insecurity and housing instability are bidirectionally linked. If you're experiencing hunger, there's a great chance that you have been experiencing housing instability. Or if you're somebody who started out experiencing some housing instability, ensuring that you're getting adequate access to food can be exceptionally challenging. Although there are programs in place to assist both hunger and homelessness, they're really not designed to meet both at the same time. They're definitely bifurcated from each other. And really, this is something that is happening at the highest level of public policy. But we do know, because they are so inextricably linked, that housing and hunger are best addressed when they're addressed together. And, these are a combination of problems that have been affecting millions of people even before the COVID-19 pandemic pushed so many more folks out of the workforce. But luckily here in Pennsylvania, we have many organizations that are creating the critical collaborations at the community level so that people are actually being able to access both housing assistance and food security programs. So with that, I am pleased to introduce today's moderator. We have Chris West, who is the Director of Life Stabilization Programs with the Greater Pittsburgh Community Food Bank. He has brought together an incredible collection of folks from all corners of Pennsylvania to talk about these really, really important collaborations to make sure that we are meeting both the basic housing needs and the basic food and nutrition needs of all Pennsylvanians. Chris, I hand it over to you.
Thanks so much, Gail, and thanks so much, Kina. We really appreciate the opportunity to be with you all today and have a lot of great presenters to share with you some opportunities for collaboration between hunger and housing and some of the great work that's already going on. So certainly look forward to your questions in the Q&A. And I will introduce each speaker right before they present. Myself, I'm Chris West, Director of Life Stabilization Programs at Greater Pittsburgh Community Food Bank. And without further ado, we have so many great presenters. We're gonna dive right into it. So up first, we have Jane Clements, who is the CEO of Feeding Pennsylvania. And I'm going to share my screen to start showing Jane's slides. And Jane, over to you.
Thank you. Thank you so much, Chris. And thank you for having us today. Still don't see my slide. There we go. All right. We go to the next one. So Feeding Pennsylvania, I'm here to talk to you about our organization. We are the State Association of Feeding America affiliated food banks. And you'll see the map here. There are 9 of them. We serve all 67 counties, and we do that through a distribution of partner agencies. And there's a little over 3,000 of those across the Commonwealth. Next, Chris. So just for those that aren't as familiar, I think food bank is typically used for both food pantries and food banks, but our network of 9 looks more like the picture on the right, a large warehouse that brings in a ton of wholesale, often items, and then we are moving that out through tractor trailer loads to smaller partner agencies like the pantry there on the left. So typically a food insecure person would not come into a food bank. They'd be there at their partner agency, and you see there, it kind of looks like a little shopping area. And then if we move on to the next one. So our role, Feeding Pennsylvania really works with all these food banks to make sure that we're working collaboratively and sharing the best practices across the Commonwealth. We share resources, we share donors, we provide a united voice around issues of hunger. We work on the state and federal levels for that. And like I said, we do fundraising, programming, and disaster response on behalf of all the food banks across Pennsylvania. Keep moving. So just a quick overview of our programs. We have a Healthy Pantry initiative that we do in partnership with Pennsylvania's Department of Health. Basically, we have a registered dietitian on staff, and we fund nutrition educators in the food banks that go out, back one real quick, go out into the pantries, and you'll see the little tags there that say low sodium and heart healthy. We really feel like it's not enough just to provide healthy, nutritious food, but we need to be able to provide the education, like you see down there, to how to cook dried beans, to be able to help people really be able to use the healthy food that they receive. And we go next. In 2015, we created the first statewide charitable fresh milk program. Dairy is the #1 industry in Pennsylvania, and we found that milk was one of the most requested items in the charitable food network, yet was rarely donated, and if it was close to expiration. So each of our food banks partners with a local dairy, and then part of the Pennsylvania Milk Marketing Board were certified as charitable milk sub-dealers to purchase that milk at wholesale price to be able to deliver it to families facing hunger. We've done 21 million servings since the beginning of that, and that number continues to rise. I'm actually in Philadelphia and South Philadelphia right now at our Mid-Atlantic Regional Cooperative. The MARC was created in 2017 with the idea that food banks wanted more access to high variety, high quality, low cost produce. Sounds like a dream, it is. So we created the MARC. You'll see down there in the left-hand corner, that's the Philadelphia Wholesale Produce Market where we operate out of. We work with wholesalers, farmers and importers to take surplus product. We create, especially since COVID, mixed boxes of produce, but also deliver wholesale produce to 29 food banks from Virginia up through New England. And we've done a little over 60 million pounds this year of that. Often product that would have otherwise gone to waste. Moving to the next one. Ag partnerships. Pennsylvania is the home to 53,000 farms, and we really feel it is our duty to partner with farms across Pennsylvania as much as possible to ensure that surplus product and healthy, nutritious food get to families facing hunger. So we administer a number of different state and federal programs that help us work with farmers to pay them for processing, harvesting, packaging, and transporting of products. So things like surplus milk, especially when kids weren't in school, we've been able to take surplus milk, process it into cheese or other dairy products, take surplus eggs, pay for the cartons, or even as you see here, the produce that we especially saw a lot of when restaurants were closed, taking that surplus and packaging it into bags for families to take home. So COVID-19 changed a lot about the scope of the work we do, because all of a sudden it was a brand new constituency of people that overnight were left food insecure, but also had never needed the charitable food network before. And I think our biggest hurdle was trying to get the word out about where we were and make sure that we had enough product, especially as we were facing issues with shippers and manufacturers in product to respond to that need. Moving on. To put it into perspective, annually, we serve about 2.2 million people, but within the first 3 months of the pandemic, Pennsylvania's Charitable Food Network served more than 5.5 million people. So like we said, this really happened overnight. I talked about the shift to a box model. You see the line of cars there, which we all saw across the news. We're still doing a lot of that box model in a lot of places to mitigate the spread of COVID. And there are still some drive-through distributions. However, there's a more of a pickup model that you'll see. But 1 in 20 Pennsylvanians have been newly food insecure. And it was projected that throughout this year, we'll see 12% of Pennsylvanians still facing food insecurity. So while people are continuing to go back to work, they're maybe not going back to the jobs that they saw pre-pandemic, or sometimes a lot of those jobs still just don't exist. So you're going to hear from a number of my members and partners along here. And I know that I've received text messages. A couple of our food banks are even listening in. So looking forward to having them share some of the information about how they're working with housing to address both issues. Thanks, Chris.
Great, thanks. Thanks so much, Jane. I really appreciate it. And we have myself next. Chris West again, Director of Life Stabilization Programs at Greater Pittsburgh Community Food Bank. And we serve 11 counties in southwestern PA. And, very newly, just after the onset of the pandemic, we created our life stabilization area with a focus on eliminating hunger. And, when we say eliminating hunger, that's going to take more than food distribution. You can see on the left there, we realize that hunger might only be one critical need that a person may have. Others, housing, of course, childcare, transportation, employment, financial stability, healthcare. So we want to, as much as we can, break down the silos between those sectors and really open up referral pathways that go both ways. When we find someone that has other needs beyond food, we're working hard to get them those resources. Maybe they don't know where to go. Maybe they aren't sure who to call. So we're giving them those resources, whether it's housing, employment, healthcare, so they can get that help. And then likewise, we want folks in the housing sector, employment, all that you see there, to when they find somebody that's food insecure, to refer them to us so we can get them, the food security programs that are gonna help them the most. So we have also with our life stabilization area that was created last year, we have a call center, which is brand new for us. So we, anybody that's seeking food assistance from the food bank that calls us, we have a team of folks answering the phone that will get them figure out the help that makes the most sense for them, let them know what options are. And like I said, other needs that come up on the call, we can direct them to other community partners that are doing that great work that they can get help in other areas of their lives as well. And coming soon, we're going to have an on-site pantry open called The Market. And we're going to be able to not only provide the pantry and a choice and a shopping experience for folks, but we're going to have our staff on site there that we can sign people up for other food assistance programs at the food bank and connect people to other resources that they might need in the community that our partners are doing, including housing, of course. And then we have Education Station is going to be, it's a classroom connected to our on-site pantry that, again, opening soon. But that'll be an opportunity for community partners to come in and whether it's signing people up for services, info sessions, letting people know what services are available. We're really excited to partner with other sectors beyond food in that way. Another new thing for us is we have online resources that cover all the sectors you see there on the left of your screen. So definitely, if you're in the housing sector and you'd like to be on our website, definitely let us know and we can get you listed on there. And then also we have a new referral form that's electronic that organizations can use to refer to us when they find somebody that is food insecure, whether they know the program that that person wants or whether they don't. It's a really quick form, and in 60 seconds they can submit it. It goes into Salesforce for us and will often same day, often next day, very quickly contact the person So it's kind of nice, instead of passing out a flyer, we will contact the person and figure out what help they need. And just some of the possible ways that partners can collaborate with us is being a place that we can refer folks to that have housing issues. So like I said, if it comes up on the call that they're struggling paying rent, they're struggling with housing, so we have those partners that we can refer folks to. And we actually just partnered with Indiana County Community Action Agency to help advertise rental assistance and help sign people up for rental assistance there. So which kind of goes to the last point on there, which is new ideas. We're always open to new ideas that you have, and how we can collaborate in new ways together. So again, SNAP referrals or general assistance referrals from the housing sector. We would love to have. There's a 2-question food insecurity screening, super quick, that can be added to an intake form you might have. And then when we're in Compass and signing somebody up for SNAP, that does include LIHEAP, which is heating assistance, and healthcare. If they qualify for those things, we can get the process started to sign them up for those as well. Summer food program. So it might be a summer food location for kids. We've partnered with many housing partners and housing authorities and sites to offer that. Senior box food distributions. Again, we have a lot of partners looking for more to make sure that folks can easily get their monthly senior boxes. Fresh food distribution. We did this during the pandemic. We partnered with Aaron Hart and Farm to Table PA, and just a plug for the Homes Within Reach conference. We're going to be doing a session on that, Aaron and myself, and I'll see folks there if you're going to the conference. So more on that there. Distributing info. So that's everything from housing partners distributing our info to us distributing info at our drive-up distributions, at our on-site pantry, the market, on our website, and community partner organizations, which is a new opportunity where we can give partners that aren't a member agency of ours, but we can get them food boxes so they have on hand. So if they find somebody that is struggling with hunger, they can immediately give them food assistance. And something that we've just barely started, I'd love to expand it more, is just the idea of welcome home boxes. So, when somebody gets stably housed, maybe they get some food boxes for a couple of months to help stock their shelves, which are likely, if they're just moving into housing, likely empty. So that could be a nice way to kind of welcome them home and make sure they have the food they need. So, and of course, open to other ideas as well. So, and my contact information will certainly be sent out after the webinar as well. So with that, we have our next presenter. So Tara Davis is the Director of Agency Services and Outreach at Central Pennsylvania Food Bank. So I will turn it over to Tara.
Great, thanks, Chris, and good afternoon, everyone. Thanks so much for having us here today. Excited to be able to talk to you a little bit more about our organization, but also some things that we've done with some of the housing partnerships here within our service territory. So Chris, if you don't mind going to the next slide, please. All right, so this is us. This is the Central Pennsylvania Food Bank. We are, as Jane said, one of the regional food banks in Pennsylvania. We cover 27 counties. So that is the lovely image on your right-hand side, would be all of the counties that we cover. So we go the whole way up to the New York border, down to the Maryland border. And all of those red little dots you see would be our program partners. reach throughout these 27 counties with our more than 1,300 partner agencies and programs. And on a monthly basis, we've been able to reach more than 152,000 individuals, providing nearly 57 million meals per year. So I'll talk a little bit more about what all these little red dots represent in the next slide. Or actually, it'll be the following slide, but this gives you a little bit better idea and elaborates a little bit more on one of the slides that Jane had shown a photo of. So how do the regional food banks work? As was mentioned before, we are a warehouse. So, you know, we're similar to a Costco or a Sam's Club when you see all those great big rackings full of food. That's kind of what we look like. And then we will sort and package the food. Our partners will order that and we'll distribute that to them, typically through delivery with our trucks. And then our partners are the ones who actually will distribute the food directly to those neighbors that are in need. Next slide. So this is in addition to your traditional food pantries and soup kitchens and emergency shelters. These are some of the other programming that we have that helps reach more specific populations or those that are not able to get to maybe a brick or mortar food pantry traditional partner. So one of our partners one of the programs that we have is our Fresh Express, which is through our mobile distribution programs. This program was really intended to be more of a supplemental program in addition to our food pantries, and provides fresh foods to high need locations. They function more of a like a drop and go. So our trucks will actually drop inventory off to these sites, and then the volunteers will set up and distribute, typically as like a just-in-time distribution. In addition to our Fresh Express mobile distribution, we also have a military share program that serves active and non-active veteran households. And we do this through partnerships with VFWs, armories, American Legions, and other facilities such as those. And we provide the food to them, and then they will distribute this to those folks. Typically, these, even before COVID, were set up to be more of a drive-through type model, to be able to pick up and go. Another special population that we do serve would be our seniors, and we do this through two different programmings. One is through a federal program called the Pennsylvania Senior Food Box Program. Some may better know it as the CSFP program. And that is a box of food that is provided to seniors that are income eligible on a monthly basis. In addition to the PA Senior Food Box Program, we also have the Elder Share Program, which is our privately funded program. So the seniors that do not meet the income eligibility for PA Senior Food Boxes are able to get those Elder Share boxes, which are mirrored after the PA Senior Food Boxes. And then in addition, we have some youth programming. We have school pantries and backpack programs that really meet the students and their families at the schools. We do summer meal programs as well. And we have a kids cafe program, which are after school meals. And we are slowly but surely starting to address the college hunger with opening up college pantries. Chris, next slide, please. So what are we doing with the housing entities, and what do our partnerships look like? These are just some examples that I threw out here on the slide deck so you had something to refer to, but we do have a lot more going on. Fresh Express probably is one of our biggest partnerships that we have with housing authorities. Most of those are before COVID would function as more of a client choice model where folks could go down a line, pick out what they wanted. Again, we focus a lot on fresh produce and other perishable goods for that particular program. The nice thing about the Fresh Express program before COVID was that it really created more of a social engagement for folks that were at these housing units as well. Our senior food box program, the partnerships that we have there have really blossomed quite well and have worked out considerably favorable for us with the housing authorities during COVID. Many seniors were afraid to go out of their homes and travel. So we were able to do direct door delivery with the help of the housing authorities. And then something that actually blossomed through COVID this year, most recently with our youth programs, was the summer meal deliveries. So because of some of the waivers that the USDA has offered to us, we were actually able to bundle summer meals and deliver them to family housing units, as well as we've done some after school programming too. That's been fairly new for us too. And then lastly, the other piece that we've done with some of our programming has been one of our pantry partners that I wanted to highlight. They're in Dauphin County, and they serve the more rural part of the county. They've been able to reach out to multiple housing units to be able to serve the more rural population through mobile distribution. So they're actually packing the boxes at their facility and then delivering to these housing units. Currently, they're serving about 75 households, and it's been really beneficial because these folks, again, limited resources. A lot of them are living in food deserts, don't have a whole lot of resources available, even if they do have SNAP benefits to spend. So being able to have the food boxes delivered to them has been really beneficial. So they deliver these on a monthly basis and have worked very closely with the housing liaisons to help make this successful. So just a few things that I wanted to touch base on about our successes with our housing partnerships that we've had. One of the biggest successes that we have seen is that this has been reducing the burden of particular barriers to food access, such as the food deserts, including the transportation and mobility, most certainly for seniors and for disabled. Also for available time for families that may have time constraints as far as school or their work schedules.
And Tara, you have about a minute left.
Oh, thank you so much. I appreciate that. So we've also been able to provide some additional healthy food options, and the housing partnerships has been rather successful because we do have paid staff versus the volunteers. It's efficient and effective. And then we've also seen the ability to be able to do other events in tandem outside of the COVID world. And then just some barriers that we've seen, though, have been some storage constraints if it's not a just-in-time delivery, and the space. Some of the housing partners are limited to residents only and not open to surrounding communities. Chris, next slide. I think that's it. So that is it. And I think I've used up all my time. So thank you so much. I appreciate it.
Thanks so much, Tara. So next we have a co-presentation. We have Kim Rogers and Jay Foster. So Kim Rogers is the program director for the Family Self-Sufficiency program at Clarifi. And Jay Foster is the director of the Ending Hunger for Good program at Fill Abundance. So Kim and Jay, I'll turn it over to you.
Thank you, Chris, and thank you for everyone who attended. I'm going to go through this pretty quickly. We have a number of slides to cover and not too much time. So we're here to talk about our food delivery program for vulnerable families. This program is in partnership with Clarifi. I'm from Philabundance, the Ending Hunger for Good department. We are serving people who live in southeastern PA, and we expect this program to begin in November and continue hopefully for a really, really long time. See the next slide, please. So why are we doing this? We all know that food insecurity is a critical need in southeastern PA and around the world. A significant barrier for people in southeastern PA around food is transportation. So in the summer of 2021, Philabundance and Clarifi collaborated to address this barrier and implement a food delivery program to participants identified by Clarifi. So I'm going to talk to you a little bit about that today. First, I'm going to introduce who Philabundance is, and then Kim will talk about Clarifi. So for the past 35 years, Philabundance has been solely focused on emergency food and relieving hunger in the moment. And while that's important, it doesn't ensure that people will not need food the next day and the day after that. So the Ending Hunger for Good department was really created to try to figure out what kind of programs, what kind of resources do we need to put together to shorten the line to the pantry, and we say End Hunger for Good. Next slide, please. So we know that social and economic conditions, or the social determinants of health, are going to determine about 80% of health outcomes. So we wanted to really create an approach at Ending Hunger for Good for our work that really takes into account all of social determinants of health and how we weave food into those determinants. Next slide, please. So we really approach our work in two different ways. We have place-based work and we have an integrated service model. Our place-based work is really focused on a geographical area. We'll look at a community or a zip code. We go into that community. We really work with the residents of that community, the community-based organizations, to highlight and understand the resources that exist in that community, but also understand where there are gaps in those resources. And then we really use, honestly, the Philabundance name. We're one of the largest nonprofits, particularly in Philadelphia, to get people at the table to really try to identify ways that we can fill those gaps. And because we're so interested, of course, Philabundance, in providing food, we pair food with the interventions that will be occurring to kind of increase the impact. And that's really what our integrated service model is built around. So integrated service model, place means nothing. It's all about pairing our resources with organizations who address social determinants of health. We want to integrate food into the programming that they are already doing. And then we try to measure the impact and see what the implementation or what the integration of food actually yielded. Were there trade-offs that were lessened because food was introduced? And the whole idea is to build a pilot program that we can talk to, you know, other food banks, other pantries about, to actually get, you know, a different way of looking at how we help people and get it widely distributed. Next slide, please. So this is our model, our integrated services model, and I'll talk a little bit more about this when we actually talk about Clarifi and how they fit in this model. But what we really do is we work with a partner's existing program. We don't want to recreate the wheel. This program has been in existence. It works. It has good outcomes. That's the kind of program we really want to work with. We just want to pair food with what's already being done to see if we can really make that impact greater. So we pair the food alongside program services. And then what's really important to us is that we partner with programs that use case management or coaching in some kind of way, so that we know multiple goals are being addressed with the person, and that referrals can be made, warm referrals. We found that in our food pantries, the referrals work better when someone says, hi, Miss Jones, I know that you you want to get your GED. I'm going to make a phone call to my partner at whatever. I'm going to give them your number, and they're going to reach out to you. And then following up with Miss Jones and the partner to make sure that that connection really happened. We found really, really good, good results from that approach. Next slide, please. All right, all you, Kim.
All right. Perfect. Thank you, Jay. So to talk about I specifically, so Clarifi is a nonprofit organization that focuses on financial empowerment services. At Clarifi, our mission is to empower individuals to achieve financial resilience and positively impact their communities. Next slide. And Clarifi is really focused on doing that work in a measurable way, right? Like being able to talk about our impacts, being able to talk about our outcomes. So we measure that impact through financial health outcomes, things like improved credit, home purchases, home retention, foreclosure prevention, establishing savings and building savings and assets and so forth. So our approach is to really kind of focus on like, how do we measure, right? Like that impact. And the way that we do that, next slide, is through 3 different approaches. So we work towards those outcomes through, number 1, financial counseling, one-on-one financial counseling, where we're having conversations, coaching conversations with individuals around general financial goals or housing counseling and so forth. Number 2 is through financial workshops. And number 3 is through our partnerships and programs, which is why we're here talking to you today, right? Because you may be thinking like, hey, what does a financial counseling service have to do with food and has to do with hunger? We're not a feeding organization, we're not a housing authority, but we understand that the best way to do what we do is to partner with those who do what we don't do, right? And for us to not have to recreate the wheel. Here's why it's important. This is a quote from a HCV, a housing choice voucher holder that uses our services. She said that she was afraid of increasing her hours at work too much because they would cut her food stamp benefits. And most of us are aware of what we know as the benefit cliff. That's that spot where families have to make that decision that if they increase their income too much, if they increase their income too much, they may see a net loss of benefits, meaning that, yes, they may have increased their income, but they're going to lose their food stamps, or they're going to have their food stamps reduced, or they may see that their rent goes up as a byproduct of them increasing their income. And at the end of the day, families shouldn't have to make that difficult decision to remain in poverty in order to ensure, right, that they have housing and to ensure that they have food resources that they need to support their household. Next slide. In comes the family program. So the Family Self-Sufficiency Program is really designed to help families increase their earned income and reduce their dependency on welfare assistance and rental subsidies. It really helps participants build assets by giving them access to an asset building account. And then it also helps individuals work towards their specific goals. It is a case management model where we're working one-on-one with participants in order to work towards their individual goals. Next slide. But as I said earlier, we are not a feeding organization. We're not a housing authority. We understand that the best way to do what we do is to partner with those who do what we don't do. And so that's why we are in love with this idea of this integrated service model, because without it, we couldn't really kind of make this work possible. FSS is a HUD program that is administered through local housing authorities. So shout out to the Philadelphia Housing Authority for being such a committed partner and committed really to their residents, to Compass Working Capital, who partners with local housing authorities to run FSS programs that focus on asset building and financial counseling, and then also to Phil Abundance for providing food resources to participants who are going to be in this integrated service pilot. And Jay is going to talk a little bit more about the service pilot itself.
All right, thank you. So
we have about less than 2 minutes.
Okay, we can do it. So this is the integrated service model kind of blown up so you can really see the components, and we filled in where Clarifi, where our partner the actions of our partner. So the first step is that we work with Clarifi to identify individuals who are experiencing food insecurity. They will make a referral to the Fill Abundance Food Delivery Program. Once we receive the referrals from Clarifi, we are going to provide on a bi-weekly basis meals, grocery gift cards, and produce boxes. These are delivered directly to the homes of individuals for 12 months. Hopefully, we can continue the program beyond that. I'll let Kim talk about the rest.
Yeah, and then steps 3 and 4 is, of course, as the FSS program has already, like we already talked about, it's a case management. We have a case management approach. So we connect participants to other resources as well. And we continue to work with those individuals. We monitor how they're progressing, and we share the data around the measurable impacts that we're having for the program as well.
Next slide. So these are some of the, and I'll go through these really quickly so we can get to the next steps of the program. Some of the short-term outcomes that we hope to see are increased quality of life, decreased trade-offs. So folks are more able to get public transportation or pay for medicine or pay for childcare because some of their food needs are being met, and an increased ability to save money. Those are what we would like to see in the short term. In an intermediate, we want to see, of course, increased rates of food insecurity, no trade-offs, increased consumption of fresh fruits and vegetables, an increased ability to save money, health and well-being, self-reports improve, and decreased reliance on donated food. And then for the long term, we want to get to a place where there's no reliance on donated food and increased economic stability where people feel they are in a stable place, housing, economically, and as far as food. So these are our next steps. We have been working on this for a while. As you can see, really want to understand the population and the program and the best way to go about this. We hope to begin the actual implementation in November. And in January. We hope to begin the actual implementation in January. And then we'll be doing evaluation in January and in June.
The last thing I just want to throw in is that at the beginning, Gail really mentioned that, housing and food should not be bifurcated in terms of how we approach it. The truth of the matter is it's not for our families, right? Like they are literally trying to make those decisions hand in hand. And so our approach also has to be comprehensive, and it has to include really kind of that lens where we're looking at both as well. So thank you so much for your time today.
Thank you.
Kim and Jay, thank you so much. I really appreciate it. And last but certainly not least, we have Dave Ritter, Director of Housing at the Commission on Economic Opportunity. So Dave, I'll turn it over to you.
Thank you very much, Chris. And it's a pleasure to be here today. So as Chris mentioned, I direct the housing programs for the Commission on Economic Opportunity. The Commission, or CEO, is the parent organization of the Weinberg Regional Food Bank. Food Bank covers 4 areas in northeastern Pennsylvania. The 4 counties are Lackawanna, Luzerne, Wyoming, and Susquehanna. CEO has been active since the early 60s. We're a community action agency and provide comprehensive services in the areas of food and nutrition, obviously, but also housing, energy, and special projects for those that are physically and mentally challenged, and the elderly in particular, as well as veterans. So volunteers play a very, very important role in our outreach and marketing efforts for both our food bank and for our housing programs. Pre-COVID, we had close to 2,500 volunteers that would help us throughout the year. And we could not accomplish our people helping people mission without the kindness of the volunteers, both in effort, time, and money to do what we wanted to do for our community. So when volunteers come to us, we have them trained for community engagement. If you think about it, the volunteer is really an ambassador of our services. And oftentimes the first person that someone would meet if they were a family in need or an individual in trouble. So that trusting relationship is just so vital as we move to higher echelon activities within the commission. So pre-COVID, as I mentioned, we had many volunteers that were going out in the field, meeting people in their homes, having major events such as Thanksgiving programs, Christmas and other holiday programs. Obviously, that was altered with the pandemic. In spite of that, we had many volunteers who, while unfortunately were impacted in ways where they had their employment interrupted, they still wanted to give back to the community. So many of the volunteers took the time to help us with our food box efforts, where we get the food boxes out to community drive-throughs to assist people with that type of housing need. And the housing need would be in part with the pandemic flyers that we would include in the food boxes, which would describe various housing and utility assistance programs which were eligible to families in our community. Next slide, please, Chris. So the commission is a HUD certified housing agency. All of our counselors and program managers are also HUD certified. So we bring a wealth of knowledge in the areas of housing utilities to all activities involving the food bank. So one of the primary activities, as was mentioned before, is in the areas of financial literacy, help people with their budgeting. And obviously food and nutrition is a big part of anyone's budget. And when food becomes available to a family, then we can take a closer look at the budget and see if we can identify disposable income now that the food need is being met to address some other areas of the family's concern, whether it be housing costs, utility costs, medical costs, whatever it might be, to help them better manage their funds on a monthly basis. As we know, the cure for hunger is food. And actually, you know, the inability to afford food or to afford housing is not something that comes alone. It should not be considered as a silo, each program independent, but really it's one and the same. If you think about housing and food are really basic essential needs of all of us. So that's our vantage point, the way we view families that come to our agency for assistance. They just at times, unfortunately, cannot afford their housing and utility costs or their food costs. And this has been extremely exacerbated, as we all know, because of the pandemic. So with our outreach and marketing activities, we're always looking for new partners. As Chris mentioned before, the communication really is back and forth. So one of the things that we have done as a housing counseling agency with our housing counselors is we reached out to do some specialty court marketing. Now the court is the Court of Common Pleas. There's 4 distinct courts that they have. They have a mortgage foreclosure diversionary program. They have a mental health court. They have a veterans court. And then they also have a specialized drug treatment court. So what was of note there is that was a venue for us while we attend to the different segments of the court programs, was an opportunity to promote our food banking efforts and then also lend our housing expertise when housing was needed to help a person in the courtroom setting concentrate on other issues they may be having, such as a veteran that has PTSD or someone that has a substance abuse problem, so they could focus on counseling. So we tried to design programs to help them not have to worry, quote unquote, about their basic needs and really concentrate on some of the underlying causes which were causing the symptoms from their involvement with the court program. So we found that to be very advantageous, and actually through that marketing effort have made a partnership with the courts above and beyond what they are designed to do. And many of the people on the judicial staff, their support staff, and the clients themselves in turn give back to the community with some of our food banking efforts. In particular, they sometimes have the community hour requirements, which are easily fulfilled within our food bank activities, as well as some of our other housing type programs. Next slide, Chris, please. So with hunger and housing, I just wanted to identify some of the 7 partners that we deal with. The commission, as I mentioned, is a very comprehensive agency, and they are able to provide direct assistance benefits for people that come into our service spectrum. And what I mean by that, for example, with people that are having housing problems, CEO was selected to administer the Emergency Rent Assistance Program, which is offering dollars throughout our various communities in Luzerne and Wyoming counties. It also is very much involved with the LIHEAP program. So if we identify someone that's having a utility problem, there's an immediate and direct referral to that part of our organization to, again, provide a direct benefit that goes along with our counseling to have a real difference in someone's life. Our vendor base, we reach out to all the vendors that are part of our network. For utilities, it's obvious the utility companies that provide service in our network, but also the fuel vendors are a part of this, and as well as in the housing area, private landlords, mom and pop landlords are a very vital part to us. So we have back and forth communication with all of our vendors, the housing authorities, and that they understand what we're doing, what we're trying to do. We think there are many side benefits when we help someone in need, that the vendor also benefits from our services. The volunteers I mentioned are, once again, a core part of everything we do. Just very, very fortunate to have volunteers. We could not do our job without them. Our HUD certified housing counselors, we receive funding from both HUD and from the Pennsylvania Housing Finance Agency, of which we are part of their network. They provide vital resources to the housing counselors. Oftentimes we run across very unique situations. It's very comforting to know that we have some backup with reference materials, case studies, legal analysis of some situations that we then utilize in a two-front area. One, to help establish policy in those areas. And then secondly, if we identify unmet needs in the community, and we have something to go with in terms of a possible fundraising, possible additional activities for some of our programs or some of our partnering agency programs, which is the next item on the diagram. We partner with the United Way in our area.
And Dave, less than 2 minutes.
Thank you. The remnants of a council of churches, synagogues, and other religious organizations to help us get our word out. I mentioned the specialty courts that are very vital to our program. And overall, it's interesting to note that many people have never heard of our organizations before. So that's why it's vital, in our opinion, that we need to keep on updating 211, our information and referral system, that someone who calls in for help is met with a friendly, helpful voice and gets them to the right party, the right agency, the right person the first time. Thank you very much for being allowed to be part of the presentation. Look forward to any questions. Thank you, Chris.
Yeah, thank you all so much to all the presenters. And I know we might not have time for questions, but we will certainly get with Gail and Kina and make sure that we answer them offline and send the answers to folks. But with that, I'll throw it back to Gail and Kina.
Great, thank you. As Chris said, we're pretty much to the end of our hour. There have been a few questions in the Q&A, some of which our wonderful presenters have been typing in answers, but anything that was not answered, we will be sure to include in the email follow-up to today's webinar. It will also include a copy of the PowerPoint presentation. It will include a recording of today's presentation. So I just want to thank our amazing panelists. You guys are just doing some really, really amazing work and really looking to pinpoint, what are the hard trade-offs that people have to make, and recognizing not everybody is making the same trade-offs, and creating the smart collaborations that are needed to customize to each household and their challenges. So again, really, really great work. We'll be sure to include everybody's contact information. So if you are looking to partner at the local level, you have an amazing slate of people to reach out to. And if they can't help you, I'm pretty sure they know somebody else who can. So with that, I want to say thank you. Everybody enjoy your afternoon, and we look forward to seeing you at our next webinar, which is going to be Tuesday at 2:30, where we are going to be talking about universal housing vouchers. So see you then.